Good morning, or good afternoon, everyone. We'll get started just in a couple of minutes. We have quite a few people still joining. All right, everyone. Good afternoon. My name is Claudia Regal. I'm the director of the City of New Orleans Mosquito, Termite, and Rodent Control Board. And thank you so much for joining us this afternoon. This is a part two of a emergency preparedness presentation or series that we do for emergency preparedness. And so I'm so excited today to introduce Ms. Meredith McInturf, and she's going to talk about the role of public health preparedness before and after an all hazards event. Now, just a few little things. Please keep your microphone on mute. That'd be great. And then make sure that you use the chat button to include questions. So you can go ahead and put in those questions throughout the presentation. We're going to be monitoring the chat, and we'll hold all the questions to the very end, which we'll ask Meredith to answer them for you. So this particular webinar is going to count for 1 hour of CEU credits for our state sanitarians here in Louisiana. So just make sure that you reach out to education@nola.gov. If you have any questions, you do need to participate from the very beginning of the presentation all the way to the end in order to receive your CEU credit for this presentation. It's very important if you'd like to follow us and make sure you're notified on some exciting things that are coming up. Follow us at NOLA Mosquito. We're on all the social media platforms. All right, so today I'm going to introduce Meredith McInturf. She serves as the unit manager for the Public Health Emergencies and Environmental Health Unit at the City of New Orleans Health Department, which oversees the work of the Planning and Systems, Community Engagement, and Field Operations team. She continues to serve on local, regional, state, and federal planning committees representing local emergency support functions, ESF8, as well as recovery support function, RSF3, the health and social services perspective, and works with the city, state of Louisiana, and community partners to respond to public health threats impacting New Orleans. Just so everyone knows, we have the City of New Orleans and other folks in the region received a pretty substantial project grant. It's a cooperative endeavor with the CDC called the Gulf South Vector. And that is really to improve the capacity of vector-borne, of really the resources and also people and process and information for responding to a vector-borne disease emergency. So if you want more information about that particular project, you can go to vectoreducation.org. The website was just put up. It's got there's going to be more to it, but at least we've got the first page that tells you the basics about the project. So with that, I'm going to kick it over to Meredith to introduce her topic. And thanks, Meredith, for taking the time.
Awesome. Thank you so much, Claudia, for having me today. And hi, everyone. It's so nice to see so many of you on the call. I know some familiar faces and some that are less familiar. So for some, this will be a little bit of a review, and for others, this might be the first time you're hearing about public health emergency preparedness. So excited to jump into it a little bit more. I'm going to turn off my camera to save some bandwidth, but it's very good to see everyone here today. So kind of going forward, public health emergency preparedness is such an interesting topic, mostly because people think about it only before an event and not so much after an event. And so Today, I wanted to make sure that we hit on both of those topics. And first, by defining what that means, what does it mean to have a public health group that is focused on that emergency preparedness component? What does that cover? What kind of rules and regulations do we have to follow? And then providing an overview of how locally in Louisiana and in New Orleans, we're a pretty unique unit that we're the only local health department that has this specific type of unit. So we're called the Public Health Emergencies and Environmental Health Unit. And so we have kind of a different mandate even than what might be in other jurisdictions across the US, and certainly different than what the Louisiana Department of Health regulates as well. And then I wanted to make sure that we had time to talk about getting involved locally, whether you're local to New Orleans or local, in your own state. There are ways that you can stay engaged with local health departments and this type of work through many different initiatives that we have, but also there may be similar programs available in your area. So to start, public health emergency preparedness can be defined as the capability of the public health and the healthcare systems, communities, and individuals to prevent, protect against, respond quickly to, and recover from health emergencies, particularly those whose scale, timing, or unpredictability threatens to overwhelm routine capabilities. So this is a really important definition that I like to bring everyone back to because there are kind of three major pieces that are highlighted, that it's not just the role of the individual to respond to an emergency that they're having, it's really the goal of the system. And so, what do we mean by systems? A lot of times people think, oh, you're the person who talks to hospitals during emergencies. And yes, that is partially true, but there's so much more in the healthcare system infrastructure than just hospitals. We're talking about urgent cares, we're talking about dialysis centers, we're talking about home health and hospice agencies, nursing homes. Locally, we'll talk a little bit more about this. We're also talking about residential facilities to some degree that have folks that meet certain health criteria. So this is a really big umbrella of communities and individuals and systems that are made up in this topic area. And the other important piece to note before we jump in too deeply is that the different health emergencies require different levels of response. And I don't think that's surprising to anyone here that an outbreak takes less resources than a pandemic to respond to. But it's really important to know that we have capabilities at no matter what scale. So whether it is outbreak level to pandemic level, the timing, if it happens, at noon versus at midnight, how does that change the capability of an organization or individual or system to respond? And then also the unpredictability. So what happens when something new that an area hasn't seen before happens for maybe the first time, or it's been a long time since something happened. So there's quite a lot to cover within this realm. And so I'm going to try to break it down a little bit and talk about the different scenarios that we go through and thinking about these pieces of scale, timing, and unpredictability. So there are a lot of laws that exist at the federal level that you may or may not be familiar with, but if you wanted to kind of dig in deeply into where did public health emergency preparedness come from, certainly it was not really talked about much before 9/11 and the anthrax attacks. So there was a lot of work after that, obviously, to formalize the emergency management system and structure, but certainly also thinking more about pandemic and all hazards preparedness as a topic area. So you'll see kind of a timeline in here. We won't spend a lot of time on each of these key changes, but we do learn something after every single event, whether that is an outbreak of sorts or if it is a threat of a different variety. Some of these key changes that occurred in 2006, for example, in this Pandemic and All Hazards Preparedness Act, required the Secretary of Health and Human Services at a federal level to lead all public health and medical response nationwide. It also greatly expanded funding and programmatic support for state and local public health to even exist. So it would be very rare, if not impossible, to be in this type of role before 2006. Expanding all hazards focus. So not just thinking about the hazard that is most in front of you, but thinking about all the possibilities and thinking about medical surge capacity, which is really looking at how do you scale up quickly to respond to an incident. and then also expanding pandemic and biodefense vaccine and drug development at the federal level. Because as we all know from COVID rollout recently, that can be a really big factor in determining how quickly an area is able to respond to an emergency based on what tools they have in their toolbox or what vaccines or drugs are available to address it. Similarly, in 2013, you'll see that it's just progressing over time. This actually changed to give now the Administration for Strategic Preparedness and Response, or ASPR, the lead for coordinating this emergency preparedness and response policy development and coordination. Reauthorizing appropriation for that surge capacity, because as we all know, none of this happens without immense funding behind it and a lot of coordination happening at all levels. And we'll jump into that more toward the end as well. And then requiring the establishment of a National Advisory Committee on Children and Disasters. So you'll notice that 2013 is right after several major events, but notably the Boston bombing and also Sandy Hook. And so really thinking about the impact of disasters on children and what different resources are available. And so thinking about how do we fund that appropriately and how do we make sure that the whole community is really involved in that process of planning. In 2019, we still had more evolving law happening. So Pandemic and All Hazards Preparedness and Advancing Innovation Act of 2019. So again, just recommitting to kind of what is a national health security strategy? How do we keep our stakeholders all on the same page? How do we actually reach all communities, and thinking about how inclusive we are in our communications or our strategies? Particularly thinking about those with access and functional needs and how they may or may not be incorporated into the existing planning processes that exist at all levels. Really prioritizing a threat-based approach in determining how we plan for different events, increasing communication in medical countermeasure, advanced research and development, and also, again, continuing to advance those technologies for medical countermeasures. So, every so often there are these kind of major changes to these public laws, and so that eventually trickles down as well to the state and local level to implement these different pieces of guidance. So what I like to say for my public health folks here that are maybe more familiar with the 10 essential services of public health that are located on the right of your screen, this is what we're really used to talking about, right? So the assessment, policy development, and assurance factors, and kind of breaking down our work in that lens and thinking about it all through an equitable lens, or how are we making sure that resources are distributed in a way that everyone can be at the same level. That's a big part of what we do in this space, but it's also combining that with the disaster management cycle, which you may be less familiar with. That's on the left side of the screen, where there's a continuous cycle of preparedness, response, recovery, and then working on the backsides to do mitigation work. So how are we building stronger infrastructure or stronger tools and having more tools in our tool belt so that we, can respond better to the next event, or prevent the next event, honestly. So you'll see some of those different pieces falling into place there. And I know this can be a little bit confusing, but if you can mash these two cycles together, the different pieces, that's kind of the world in which we live in public health emergency preparedness. So that is a quick overview of the history. And so in the New Orleans Health Department, across our entire department, we have a mission to promote, protect, and improve the health of all in our community through equitable policies, programs, and partnerships. And so part of that, we know that as the city of New Orleans and as one of the few and the largest local health department within the state, we actually have a larger responsibility of building a healthy and equitable New Orleans by supporting the well-being of everyone in the region. For those that are in the New Orleans area, you know that most people in the region don't necessarily know if they're crossing the parish line to access services. There are not hard and fast boundaries here. Some of our major healthcare players are in neighboring parishes. So when we think about our work, we have to think about it regionally. We can't just look at the parish level. But we do, directly support residents and stakeholders within Orleans Parish, but have to open it up a little bit wider to think about all the different hazards we may experience. So within our department as a whole, we have many different teams and groups that focus on different aspects of health. And that's also important to note when we're thinking about our work in the public health emergencies and environmental health team, that we not only have a response to, or a duty to help our residents and stakeholders and external partners, but also working to prepare our internal teams as well. So we tend to be at the planning table for a lot of conversations that would greatly benefit all of these groups and their expertise and opinions. And so we try as much as possible to bring them into our conversations about emergency preparedness. And a few that I'll definitely shout out, our maternal child health teams are really out there trying to collect information about families and how they may or may not be preparing for these types of events. I saw that we did have a few of our Family Connects team on the line. So Family Connects New Orleans is a universal postpartum home visiting program that allows for anyone who gives birth in an Orleans Parish hospital and they are an Orleans Parish resident to receive at-home visits. And, we're excited to continue to partner with them as they are really reaching a key population within our city by, meeting parents where they're at when they bring home a baby and talking to them about how that would change their emergency planning process. And so being able to have those tools and materials readily available for that team alone and thinking about all the other teams that do great work within our department, that is part of our role at the city, is facilitating those conversations and making sure that there's access points for asking questions and getting information. We also have, our population health and policy team that we work very closely with on all sorts of initiatives, whether that is chronic disease prevention and the intersection of food access, particularly before and after an event. And that's a key factor we're going to talk about later. Our behavioral health group, there are so many things you could talk about on behavioral health and emergencies alone if I had more than the allotted time for today. But we do have a mobile crisis intervention unit, which is the fourth wing of 911 response now, that has behavioral health professionals who can respond to nonviolent incidents in the community. And so thinking through what does their role look like in an emergency and how do we assign them and use them in ways that help our community, with the kind of acute care needs that they need, but connecting them to long-term services. Certainly we also work closely with our Healthcare for the Homeless unit, which is a federally qualified health center that serves folks on a sliding scale. So, individuals do not have to be unhoused to use those services, but that is kind of our clinical arm of our operation. And so working with them to think about clinical skills that transcend just, kind of local issues and thinking about things outside of the clinic as well. Violence prevention, certainly there's a lot of overlap in the work that they do with keeping communities safer and writing policies and laws that promote safety. Our Ryan White program, and then obviously the backing of our administrative team that help us do the work that we do. But it's hard to talk about our work without mentioning kind of all of the partnership that we have internally within the department as well. So specifically on our team, I wanted to kind of dissect public health emergencies and environmental health a little bit more, talking specifically about our emergency goals. The first of which being that we want to enhance the systems and processes that impact the health of individuals with access and functional needs during emergencies. And so a lot of people would say, what does an access and functional need mean to us? And that's wide ranging, right? This could be somebody who is unhoused. It could be somebody who requires electricity to live their life, whether that's through durable medical equipment or other needs. It could be a pregnancy related need where it might be a temporary access need to have services regularly, but once they give birth, perhaps they no longer have that need. It could be those that are living without transportation or without reliable transportation in our city, which is very common and is at the center of most everything we do. We think about transportation a lot more than maybe some other cities in some respects, but thinking about how people are accessing our services. Folks that have medication needs, that whether that is regular visits to a doctor's office or if that's something that can be managed at home, thinking about how that may change if a pharmacy is not available, day to day, that might cause problems. We also think about our individuals who are in hospitalized settings or other institutional settings and how the systems and processes may play into their ability to prepare or respond to issues. And then also the folks that are differently abled or, that may use assistive technology or durable medical equipment and how that plays into their ability to prepare as well. So really all of this falls into goal 1, and we can talk about some examples of this as we go along, but just thinking about that. And then goal 2 is really strengthening the systems, processes, and capacities of city employees and our volunteer corps to prepare for, respond to, and recover from acute and prolonged disasters to improve their contributions to city emergency functions. And so what does this look like? So, I am a certified basic life support CPR trainer, for example, and that is one thing that we like to do to prepare our team not only internally but also externally for special events. So let's think about Super Bowl or Mardi Gras or all these great things that happen. We deploy volunteers to be out there and to be trained so that if something happens, that there is a response element that's faster than EMS to get to certain situations. We also do a lot of training in City Hall, out in classrooms. We go to schools and universities frequently. And we're out there talking about things like we're talking about today. We're talking about other specific skill sets. Maybe it's specific to a hurricane or to extreme heat or another hazard, but how to really apply those and do something as a result of that. Could be first aid training. It could be just other team building training and really connecting people from different backgrounds. You would be surprised, for those that are not in the public health or medical space, how little public health schools, nursing schools, medical schools, social work schools, et cetera, talk to each other. And just having that option to bring people together under one response group and have conversations together is really something powerful that we like to do and specific to public health emergencies. So within that, we do work very closely with many of our internal city partners, including mosquito control, but also our New Orleans Office of Homeland Security and Emergency Preparedness, which is NOSEP. And so this is the opportunity we have to really implement some of those national frameworks or laws that we were talking about in the beginning and implementing at a state and at a local level. So as you'll see here, you'll see a federal lead, you'll see a state lead, and then you'll have local leads and support agencies for each of these functions. So as Claudia mentioned earlier, emergency support function 8 really focuses in on public health and medical services. So that is the assessment of the different needs that are happening in the community based on the event. Other like infectious disease health surveillance, for example, or just general chronic disease surveillance potentially. Medical care personnel, and are they available and are they trained to do the different things that are being asked of them in the community? If there are kind of public health, medical, or veterinary equipment or supplies that are needed for a certain task, that is part of our role, connecting people with those tools, providing training. Patient evacuation is another one. So in the event that a healthcare facility there's something going on there, whether that be a natural hazard, a man-made hazard, or otherwise, there's a role in that for all of these agencies to play. Patient care certainly is a big part of it, thinking about more at the system level, but certainly there are examples of that happening pre-hospital or actually post-hospital as well. Behavioral health care, as we talked about earlier, public health and medical information dissemination, vector control, drinking water availability, mass fatality management, and so much more, really. This is one of the biggest ESFs probably, and kind of has a wide-ranging scope of partners and opportunities to engage with others. So this is one way that we organize our response. So there are, depending on where you are in the country, there are kind of 15 established ESFs. In Louisiana, we have 17 established ESFs. But through the national framework, it gives us a common language so that no matter if I'm talking to somebody from a colleague in Texas, they're going to know what ESF 8 means and generally what I'm doing or what I'm contributing to. So similarly, ESF is usually used more in the context of preparedness and response. We also have recovery support functions. So recovery support function 3 is called health and social services. This one I will say is a lot newer to the city and to kind of everyone. So at the federal level, again, it's still an HHS-led initiative. At the state level, it actually does involve more stakeholders. The lead is currently the Louisiana Department of Children and Family Services, with support from the Louisiana Department of Health and the Department of Education, actually. And then locally, our leads are us, the New Orleans Health Department, the Office of Youth and Families, and then the United Way of Southeast Louisiana. So this group, really came together actually in 2022 to make our first RSF framework, which you can find online on the NOLA Ready website. For those that are not familiar, I can drop a link in the chat later. But the primary objectives of this plan are really to assess and prioritize the community health and social service needs after an event, thinking about ways to restore healthcare and maximizing public health and social services functions after an event, not in the immediate aftermath, but thinking more long-term down the line. If something has happened, how do we restart those different functions? And then restore and improve resilience and sustainability of the healthcare system and social service capabilities and networks. So this really looks at how do you restart a whole process, or how do you build back stronger after an event happens? And so this being a newer framework, I will say that's been very interesting to interact with all these different partners, particularly through the state RSF network, and to learn about their functions and what they are thinking about and prioritizing, and how the interplay of public health and education and kind of other social service needs really come together, and that they don't really exist without the others working, right? You can't just have a strong education system without an equally strong healthcare system, and vice versa. You need all of those things working together to restore an active community. And so within the recovery support function framework, there are 6 RSFs that address different areas. So economic stability is one, community improvement and planning is one. There are 4 others, but essentially, thinking about it in the sense that maybe these are partners that you work with less currently, but you really do depend on them to offer those core services and functions. So in the city of New Orleans, we spend a good amount of time thinking about a lot of different hazards. I actually couldn't fit all of the different hazards onto one slide, so I'll just kind of do a quick overview. But if you're curious, the 2020 City of New Orleans Hazard Mitigation Plan is on here as well. But we experience a lot of different hazards, and so there's a lot to consider when we're planning or having these conversations about, preparing or thinking about recovery. So, whether that's flooding, hurricanes, tornadoes, extreme heat and drought conditions, availability of drinking water was something that we experienced last year with our saltwater intrusion issue through the saltwater coming up the river from the Gulf of Mexico, extended power outage, infrastructure issues, or even collapse potentially, hazmat issues, and so many other things. So we have to think about all of our responses in this all hazards context. Now, while there may be specific actions that we know this is better for hurricanes, thinking about the ways that we provide training, or that we buy resources or other things like that, we have to think about it in a holistic way. We hope to never see all of these things in one year. I'm going to knock on wood right now because I may have jinxed us, but this is something that we build up over time. And similarly to how you saw those laws changing over time at the federal level, new local policies get developed after events to respond better to those things when they happen in the future. So we'll talk a little bit about that in a bit as well. So another important thing that we do within the NOHD Public Health Emergencies and Environmental Health Unit is preparing for the next pandemic today. So while a lot of people may say, COVID-19 is over, I'm glad we're done with that. We think about pandemic preparedness pretty much day in, day out, and it didn't start with COVID. I was thinking about pandemic preparedness in 2019, not because of anything that was happening, but just because this is part of what we do every part of the year. So annually, our staff, our community partners, our volunteers are always engaged in the update of the city's mass dispensing plan. So how do you get commodities out to communities quickly? One of those may be in a medical fashion, like a vaccine or a testing opportunity, testing site. But it also could be for a hurricane, like a water distribution, tarp distribution, sandbag distribution, all of these different things. So how are we thinking about that plan and updating it as we know things change in our community? How are we meeting with our community stakeholders to make sure that they know of their roles maybe in these plans, or talking with us about how they could contribute to these plans to make them stronger and better? We do a lot of staff and partner communication notification drills to make sure that we're staying up to date with these partners over time. I can tell you that turnover is pretty high, citywide in a lot of roles, and so making sure that you're maintaining that regular contact with these partners is really important, so that you don't miss out on somebody who's needs to be at the table during an event when it happens with very little notice. We practice setting up different facilities. For example, in vaccine sites and drills, we use a lot of our recreational facilities locally, or we've used music venues, concert places, gyms that are not city owned. We've gotten quite creative with parks and using different overhangs and things like that for vaccine events, but trying out different sites and seeing what works, what doesn't, what are the limitations of those different buildings or areas. We do have regional conversations around mass dispensing, and specifically planning meetings that happen at least 4 times a year, if not more, depending on the year. We do a pandemic influenza full-scale exercise, which actually brings staff and volunteers in to practice these skills once a year. And that didn't start because of COVID, that happened before. And we also do a lot of discussion of anthrax or other category A threats, which are the most infectious or the most concerning threats, and do kind of tabletop or discussion-based exercises around that, and think about different portions of that plan each year and how to strengthen the different responses that are possible. But that is all made possible through city's readiness initiative funding, which comes from the federal level. And that's provided to our most populous cities or metropolitan areas in the US to do this type of preparedness and thinking about how do we reach the most population we can with the resources we have. So we're very grateful for this. We have a very small chunk of it overall, but having that reason or conversation starter with funding has helped us expand our partnerships between NOHD, the Louisiana Department of Health, our offices of emergency management on both state and local levels, federal partnerships, and all of these different groups, and thinking about response to events. And certainly this is also a big part of our Super Bowl planning conversations as we prepare to host in 2025. And so, really being able to use this planning background and structure has greatly assisted us in having those conversations and making it a much smoother process. So as we like to say, we don't just think about public health emergency preparedness when an event happens or as it's happening. We like to engage partners when skies are blue and have good relationships with folks in the community and try out different initiatives when there's nothing happening. So for example, in 2021, we highlighted 2 of these events. So we did the Crew of Boo Parade, which is our local Halloween parade, and having an opportunity to have some fun with staff and volunteers dressing up like Dr. Fauci, walking through the streets of New Orleans, collecting information about mask wearing behaviors, and also passing out rapid test kits for COVID and having people report back their results. This was at a time when there were kind of less testing resources available. So we did have these test kits, and we were trying to figure out how to get them out in the community. And so this was a fun way to do it that engaged staff, volunteers, businesses, et cetera, and made it a little bit fun, right? And that's what our goal is, while trying to improve health, obviously. We also do an annual event on kind of vaccine preparedness with COVID and flu. This has been, I guess, about 4 years in the making now, with our the Mystic crew of Femme Fatale. We've actually partnered with a lot of Mardi Gras organizations, but specifically Femme Fatale, to do an annual flu and COVID-19 booster event, where they actually have all of their medical membership sign up as a volunteer. They go through the credentialing process that they would have to do for any sort of emergency. And they're able to assist us in providing those vaccines in the community and helping to promote that this is a protective action before the holiday season each year. So we're really grateful for their continued partnership and the drive behind, why they're doing this. They came to us and said, hey, we'd really like to make sure that Mardi Gras can happen. What do you need us to do? And this was kind of one of the partnerships we were able to come up with for an annual kind of November, December timeframe. Some of the other pieces that we work on outside of the emergency preparedness side, and this is more of our policy piece, is that we have local policies that have grown out of previous experience with events. And not all of them are events that we have experienced locally, but they are things that we've noted. So the first of which being that we enforce a local nursing home generator requirement, which was actually written locally in 2018 after Hurricane Irma hit Florida in 2017, as a way to support nursing home residents during extended power outages after hurricanes. So this requirement obviously was in place during Hurricane Ida that we had here in New Orleans in 2021. And most of those nursing homes were required to have, again, that generator. They were required to submit an emergency plan to the city. And most of them that did shelter in place had a robust plan. And they had kind of a generator and backup contracts to service that available. And they fared quite well for that event. On the flip side, and this is what we say is like our continual area of improvement, is that we did develop a new policy after Hurricane Ida in response to the kind of lack of communication between independent living facilities. So these are not medical facilities, but residential facilities that house seniors and folks with disabilities, where now they're required to submit an emergency plan and have a daily communication requirement with city leadership. And creates a really, they're not required to have generators because there are so many facilities, and that's not really how all of them are designed, but they are required to have a standard procedure for, who to contact, how to know if there is an issue arising at your facility. This allows us to do a lot of preparedness education and also to have that clear line of communication when it's needed most during disasters. So the next section really goes into how can you get engaged in local public health preparedness. So, we have a lot of opportunities in New Orleans, but there's also certainly a lot of opportunities outside of New Orleans as well. You'll see some examples here of, our team at Mardi Gras working at a first aid station at the Circle, for those that are familiar with that site. Again, some of our data collection efforts and then flu shot events, but there are quite a lot of things to get involved in. So the first of which is actually not a volunteer event. This is more for local professionals or folks that are interested in getting engaged in health conversations. But we have a community health improvement plan that is maintained at the health department level. So it is a 3-year plan that focuses on implementation to integrate individual organization work plans to align with common public health goals. And so within this, there are 9 priority areas, or 3 overarching areas, and then 9 priorities. And, depending on what your interest area is, you might say, I'm really interested in access to care on the behavioral health side. But where we come in at our team is through the ensuring community safety and public health threats component. So we're going to talk a little bit more about that as we go. But, the group or the common goals among the group are really to increase collaboration between academic and government entities to address local infectious disease threats, improving capacity and coordination of city departments to address public health emergencies. And we can talk a little bit about that as well. Like, what does that look like? Increasing stakeholder collaboration and engagement in providing timely and appropriate services during public health emergencies, and then reducing negative health impacts to extreme weather events. So within this, you don't have to be within a local health department to contribute to these issues. There are a lot of ways to get engaged, whether as a volunteer, as a work group member, or otherwise, to keep these different things moving forward. And this is one of the areas where we're so glad to have the Gulf South Vector Grant as an opportunity to collaborate between different academic entities and government, particularly to address local infectious disease threat. And so we really track a lot of our efforts through that side of that project in this plan as well. And certainly, improving capacity and coordination of city departments to address public health emergencies. You might say that sounds really city focused, really city specific, and to some degree it is, but also there are a lot of opportunities to bring in external trainers to inform not only public health staff, but really all staff of the city about how to respond to different portions of public health emergencies. Certainly there are, gaps in what, every individual health department person knows, but then you think about incidents like COVID or a larger hurricane response or otherwise, where, it takes a lot of public health knowledge from a lot of different stakeholders, whether they're in construction or they're in the parks department or they're in, a library, and being able to put forth public health recommendations or sanitation rules or explaining to somebody why they have to wear a mask, for example. So really thinking about how do we increase those training opportunities to better respond in the future to different emergency types. So separate from the Community Health Improvement Plan, we also have our local Medical Reserve Corps program. So in New Orleans, it's very easy. You can scan this QR code to get engaged. This is probably the easiest and most low barrier way to try something out, see if you're interested. And then if you're not, there's no harm, no foul there. If you're outside of New Orleans, you can always go to asper.hhs.gov/MRC to find the local unit that's closest to you. But we're lucky to have, probably a mid-sized unit, small to mid-sized unit. Some cities have very large Medical Reserve Corps programs. And so, this is one way that you can organize your volunteers to have common goals, and they share the same national core competencies, but apply them to their local jurisdiction. So we are lucky to sit in Region 6, which includes units from Texas, Arkansas, Louisiana, Oklahoma, and New Mexico, and having open lines of communication between all of those unit leaders to say, hey, I'm experiencing, let's say, a hurricane for the first time, or I'm experiencing extreme heat for the first time. How do you address that in your jurisdiction? For us locally, it was definitely looking to Oklahoma when we had our, kind of series of tornado outbreaks, if you will, and saying, hey, how do you use medical volunteers in that capacity? But there are generally some shared goals, shared language, scalable response structures that can be pulled from people within your region or nationwide. So we're very lucky to be part of this group and providing not only an opportunity to talk about medical issues, but also larger public health issues. So you don't have to have a medical background to be in the MRC program. You just have to have an interest in improving the health of your community, whether that's through risk communication, leadership skills, public health education, clinical care, or other things. We've seen really all sorts of professional backgrounds engaged in this program over the years. So it's never a bad idea to try it out, see if it's for you. And if not, again, no harm, no foul. We also have a fairly robust internship program at the New Orleans Health Department. So there are a lot of opportunities on our team to get engaged, but also in any of the other areas that we talked about today. And certainly a lot of areas that if you're primarily interested in, let's say, clinical care, but you had a small interest in emergency preparedness, we would be happy to work with you on, part of your internship being targeted at that topic. So currently, we're working on writing out full descriptions for everything that will be open this fall, but generally we have some sort of climate and health internship opportunity to talk about the impacts of extreme heat, air quality, vectors, flooding, something every year, every semester. Specifically, we'll have a vector-borne disease preparedness intern as well. And then I know for sure we'll have preparedness planning for older adults as a topic area. And so each of these, get created by a member of our team, where you get direct supervision and mentorship from everyone on our unit, and an opportunity to work across different backgrounds, across our department, across different units at the city. It's a really unique opportunity that all of our internships are also paid, which is a great advantage for those that are interested. And now I think I'm opening it up for questions, if there are any. Feel free to either take yourself off mute or to put it in the chat, but I'll turn it back over to Claudia for that.
Thanks, Meredith. Yep, thanks. Really wonderful webinar, great information. So anyone attending, please add your questions right in the chat, and we'll go through these. But make sure that you look at our websites, Vector outreach.org. That's going to be the website for the Gulf South Vector. And of course, if you have any further questions, you can always email education@nola.gov. So very important. These webinars are recorded, and we do place them on our YouTube channel. So all you need to do is go to City of New Orleans Mosquito and Termite Control Board YouTube, and it will get you to our channel. And definitely follow us on social media so that you can stay abreast of what is out there for training. We have lots of great opportunities that are coming down the pipe, from webinar series to a podcast is coming soon. But there's lots of good written content that is there. Don't forget to visit the website for the New Orleans Health Department. They have lots of great resources for everybody as well. And with that, I don't see any questions in the chat. So just a minute or so just to see if anybody else has anything. All right. Well, if not, look, we appreciate everybody's time today. And again, thanks for taking your afternoon. And Meredith, thanks so much for spending time with us and giving us some great information. So with that, everyone, have a great rest of your week. Thank you.